My name is Teresiah. I am a research scientist. I'm a resident of Kisumu County. For years I've had issues with my sinus and I've been treated on and off with antihistamines mostly and nasal sprays. Over time it got better and it got worse the last 2 months. I've had a blockage on my right nose for the past 2 months. It seems like I had an endless pit of mucus. Even if I blow, it doesn't end. I've also had constant headaches during this period. I was given the strongest antibiotic to treat the infection in my nose, but it didn't get any better. So I started scouting, looking for an ENT in Kisumu, and a colleague of mine told me there is a doctor called Dr. Ghanem Mounzer. So I booked an appointment, and once I got here, he recommended that we have a CT scan so that we can get the best diagnosis.
When I look at her condition, I just recommended immediately her to have CT scan. And CT scan showed unilateral, one-sided maxillary and ethmoidal sinus ossification. I told her it's most probably the cause of her symptoms is a fungal infection and she needs to be treated surgically. We prepared surgery and successfully eradicated all the sinus hyphae, the sinus infection inside the right maxillary sinus and anterior and posterior ethmoidal sinuses. And today she recovered very well. We showed her, we sent the specimen, it's fungal infection. My message even to the doctors, and if in case of no response to several antibiotic and anti-allergy treatment while treating recurrent persistent allergy, so it's better to consider doing CT scan for paranasal sinuses and have the referral to a proper ENT surgeon to treat this case. And our nutritionist will elaborate more about lifestyle modification which can lead to prevent recurrence of fungal infection in the sinus. Thank you very much.
There are several things that we can do in terms of nutrition, in terms of preventing occurrences of sinuses. One of them is having good immunity, and to have good immunity we need to eat foods that are plenty in immunity boosting nutrients. For example, we need vitamin C, which comes from fruits, especially citrus fruits, and also things like vegetables, and also other sources like supplements, but which needs to be taken in conjunction or in consultation with the doctor. Secondly, we need to take foods that are rich in probiotics. Probiotics enhance good gut environment, and probiotics, these are living organisms that live in our stomachs or in our gut. And if you have good environment of probiotics, it gives you a good chance of preventing fungal infections. Thirdly, we need to reduce foods that are high in sugars and simple carbohydrates. Fungi thrives very well, or we say it grows very well in the presence of a lot of sugars. So we need to take foods that are high in fiber or that are wholesome, that will reduce the chances of the body having lots of sugars. To conclude, a well-balanced diet that is rich in immunity-rich nutrients and low in sugars and probiotic-rich can play a great role in enhancing your chances of reducing fungal infections.